I'm Dr. Ruthlyn Salvosa. I have a clinic here in Quezon City, Scout Grados. I find a Faces Clinic here at the Zen Institute.
So, Doc, ready ka na ba?
Yes, let's proceed.
Kayo ba guys? Ready na kayo for Mento? Ready ka na ba, Doc?
Yes.
So guys, start na tayo usapang ilong. Yes.
Rhinoplasty, actually, we can have different options. Like nowadays, mas preferred use silicone or vortex. But actually, we can use something from our body, which can be your own cartilage. We get it from the ear, the nose septum, and ribs natin.
Doc, tanungin ko na din, speaking of silicone or vortex, ano yung difference nila and kailan yun yung gagamitin sa isang patient?
Before I do my procedures, I usually explain it to my patients thoroughly. Kasi silicone, ito yung mga previously na ginagamit before. Like, mga time pa nila naloxone. In other countries, it's already obsolete. Hindi na siya ginagamit. Pero in the Philippines now, I noticed na during the time of pandemic, because silicone is much cheaper, medyo dumami na ulit yung gumagamit ng silicone. So, I'll give the pros and cons. Sa silicone, it's easier to do. It's like around 30 minutes to 1 hour. We can do it under local anesthesia. But the result is not that natural looking. Medyo mataas na mataas, or sometimes, depende sa brand na gagamitin mo, hindi natural looking yung nagiging result. For silicone, medyo madami din yung rejection. Yun yung nakikita natin na in the long run, like 5 to 10 years, nag-infect or parang halata, medyo nakatusok. In short, generally, silicone is prone to rejection. Vortex naman on the other hand, as I describe it sa my patient, parang siyang foam. Yung foam, meron siyang butas-butas. The soft tissue can seep in. Ibig sabihin, papasok siya doon sa mga butas na yun. Naging part ng katawan mo, so it's not moving or it's more permanent. Yun nga lang, vortex is more expensive than silicone.
Guys, alam nyo na ha, kung may budget kayo, go for vortex.
Yes, go.
Pero kung gusto mo na kaagad and wala pa masyadong budget, go for silicone. Pero tandaan, hindi ganun ka-natural yung silicone. Sabi na nga din ito. Eto naman, Doc, gusto ko din tanongin, di ba, you get either cartilage or may nakita din ako sa ribs.
Yes.
Kailan cartilage, kailan ribs yung kinukuhanan?
So personally, kasi in my practice, I'm an ENT and a plastic surgeon. So I'm more comfortable in using the ears. Ako, I do combination. Vortex here for the bridge, and for the tip, I use cartilage. There are patients na gusto nila pure ear cartilage. Ibig sabihin, I'll harvest both ears. So parang I'll get one from here, I'll get one from here, then that's what I'm gonna use for the augmentation. Kapag pure ear yung ginamit mo, less ang chance na ma-reject siya or mag-infect. Kapag naman sa ribs, usually in the Philippines, we reserve it for revision cases. Like for example, third or fourth na hindi na tayo pwedeng mag-vortex, hindi na tayo pwedeng mag-silicone, wala ng ear na gamit na. So, we're gonna use the ribs. Some countries naman, like in Korea, kapag gusto ng patient na ribs, automatic ribs na yung ginagamit. But ribs is usually more expensive.
Guys, mas
Yes.
mahal yan. Again, guys, kung hindi nyo naintindihan, pag uulitin yung cases, usually third or fourth time, doon tayo kukuha sa ribs. Pero Doc, sobrang obvious ba pag sa ribs?
There are two techniques, no? One, sa likod sila. Ang tawag ng posterior approach, so di halata. Okay? And the other one here naman, hindi din masyadong halata. Pero syempre, if you do not want to have the ebidensya or parang bakas na nagparino ka talaga, I usually harvest here sa posterior.
Oh, alam niyo na ha, itago ang ebidensya.
Kaya sometimes may mga artista nagsasabi na hindi sila go or something. Check niyo yung likod ng tenga.
Guys, pag nakakilala ka, di ka sure.
Check mo yung likod ng tenga.
Para sa mga viewers natin, ano yung mga restrictions or bakit magpapagawa lang?
Yes. In generally, we don't want infection. So, bawal mo na mag-smoke or uminom ng alak. Bawal din yung strenuous activities like wall climbing or rock climbing, ganyan. Mga pang-level ng construction worker. Bawal magbuhat or exercise for 1 week. And then, ito yung like yung sinasabi, especially summertime. Bawal ang swimming for 3 months, okay? Because your nose is still healing sa loob, okay? So, if ma-infect, like you go to the beach, pwede mag-infect. For couples, issue to. So, no sex muna, no sexual intercourse for 2 weeks.
Kung kailan daw pwede makipag-intercourse after 2 weeks pa, guys.
After-
So, ingatan yung mo na
Depende siya sa doctor, but ni-advise kahit after 2
After
weeks.
6. Taste ganda muna. Taste ganda.
Taste ganda talaga.
Yung procedure pala, anong katagal usually?
Okay. My technique because I harvest the ear, I harvest the septum, which is also a cartilage inside the nose. The vortex, carbine, and Rhinoplasty usually takes me around 3 to 4 hours. For new cases, hindi pa na-operahan before or wala pang threads or fillers. Pag revision, we expect a little difficulty. Mas matagal ng konti. May take around 4 to 5 hours.
What to expect ba? Before, during, or after?
So, before, part of my pre-op assessment sa patient, syempre, kunwari, they're living alone, sabihin ko, they have to prepare the food. Kasi sometimes, mga patients, hindi sila lumalabas ng bahay for 1 week. You have to prepare, syempre, financially, you have sa work, and yung mga medications, like if you're taking aspirin or clopidogrel, yung mga anticoagulants, wag muna, no? Stop muna siya for a week before the surgery. Other medications, okay na. After the surgery naman, same, wag muna i-resume yung anticoagulants, and then yung smoking, and yung mga sexual intercourse, bawal muna. Expectations, may swelling and bruising. I always tell my patients, hindi ako magician. I can only do the magic during the time of surgery. Pero yung swelling, bruising, it's part of the healing process. I tell my patients na you can say that this is the final itsura or final look on the 6th month. Okay?
6 months.
Yes. You see from lalo na first to 3rd months, there's a little swelling. Parang ikaw na lang yung nakakapansin. But as time goes by, few months, medyo nawawala na siya. So, pinakamaganda, final look, 6th month.
6 months.
Yes.
Doc, ito na nga. Gusto kong tanongin. Ano nga ayusin mo sa iyo?
Actually, your nose is very nice na, no? So,
Okay.
when we do assessment for the nose, we have to check yung overall, like, shape ng mukha, taba ng cheeks, or lapad ng cheeks, also the chin, upper lip. So, it's called facial harmony. So, for you, we'll look at the front view at saka side profile. So side mo naman, okay na yung nose mo. It's a little drooping lang ng konti.
Nakabahala ko.
Maganda yung bridge, I'm sure.
Okay.
Pero that tip, it should be projected. Medyo pataas. So, if you're gonna ask my expert opinion, only Rhinoplasty. Ipansin mo your nose, ang tawag namin dyan, parang parrot beak, no? It has a good bridge, but it's drooping pababang gano'n. Okay? Kaya medyo love ka ni Lord, konti lang yung kailangan i-improve.
Doc, papagawa na ako.
Sige, schedule na natin yan.
Oh, guys, alam niyo na yung lalaitin sa akin na
Usually, the minimum healing time is 1 week. No, but sometimes patient kasi iba-iba yung healing. Some patients medyo matagal sa nagsaswell, like 2 weeks medyo may swelling pa sila. Siguro about 80% of my patients in 1 week, they can resume work na. Yan. So, 1 week, depende. May mga patient kasi they swell a lot, like coffee talaga, parang nag-allergy sila. It's normal, it's a case-to-case basis. So, depende siya sa patient. But on the average, 1 week is okay na.
guys, mag-ready na ng 1 week ha. Tandaan niyo na pag nawala ako. Ano ba yung cost of care after mo magpagawa ng ilong?
So, for the post of care, I usually tell my patients, madali yung pag-oopera ko, but half of the recovery is from the patient. Ibig sabihin, kailangan you have to clean your nose 2 times a day. I'll give medications, antibiotics, you have to take that specifically para wala tayong infection. And then, for 1 week, meron tayong cast na nilalagay para hindi masyadong mag-swell or mamamaga yung patient. And then, after 1 week, kailangan mo bumalik for the removal of sutures. After that, ang balik na sa akin is 1 month for the follow-up.
Ang dami nagtatanong nito, Doc. Na-observe ko din talaga to. Ilang beses bang pwede ipaulit yung rhinoplasty?
Sometimes may mga patient, though not my patients, may mga patients na nag-hop, no? Doctor hopping yung tawag. If they're not satisfied with their nose, they're gonna go to the other doctor. In my training, we were told na when you do rhinoplasty, do it once. Ibig sabihin, gawin mo na siya ng maganda, ng isang beses lang. So, ang thinking ko lagi when I do, ito na yung first and last na patient ko. So, I do it like as much as possible, perfect or without problems. Di ako nagmamadali, I take time. Sometimes kasi, may mga patient na sila na yung hindi nasa-satisfy. Hindi na siya tama if pabuti na ng 3rd or 4th time. Parang mali na yun. Because it's the patient satisfaction na, not the doctor's work.
Guys, makontento na tayo sa pinagawa.
Yes, so, pero syempre, if may kanari, grossly, may mali talaga, or tabingi, or medyo malaki pa, needs improvement, pwede natin i-revise.
magkano yung ipepete? Kahit approximate lang.
Okay. I will not tell my price,
Yes,
but
yes.
usually it starts from 60,000 onwards. Okay. Why? Siguro for bigger institution, it's around 180. No, but for smaller ones, like siguro nagsistart pa lang ng doctor or smaller clinics, they price it like 65, ganyan. It will matter kasi if we will do it under local sedation or IV sedation. Usually, for non-surgical, I reserve it to those na medyo okay na yung nose. Like, for example, you have good bridge or you have good tip na, so pwedeng improve na lang, threads or fillers is okay. Pero kunwari, may mga patients na, sorry for the term, medyo pango, malapad yung nose, or makapal yung balat, rhinoplasty pa din is okay. So, depende siya sa case or sa itsura ng nose. May mga patients din na hindi pa sila ready for surgical. Like, Doc, mapapalayas ako sa bahay. May mga ganyung patient, no? Na hindi pa sila pinapayagan kahit matanda na sila. They do conservative muna. That's fillers and threads. So, depende siya sa case.
Pag kunyari, nag-thread ka, then plan mo mag-rhinoplasty, you have to remove it.
Depende. Usually kasi threads natutunaw na siya or it starts to melt down in your body like mga 6 months onwards. Sometimes, I do operation na galing previous threads, may mga natatanggal pa ako. If I see it during the operation, I remove it. Pero kung hindi ko siya nakita na or na-melt down na siya, I let it as is na.
Anong qualities para sa'yo yung dapat hanapin pag magpapagawa?
Number one, best if the doctor knows the anatomy. You would say I'm biased, but syempre, gusto mo yung doctor na ENT and facial plastic surgeon na. Kasi kahit pagbalik-balik tayo ng may mukha, anatomy ng nose and anatomy ng face, alam nila. Number two, better if you trust your doctor. And how do you trust your doctor? Ibig sabihin, okay, mag-explain. It takes time for you to know your options or explain your options. And gives you your options. No, for example, this is the comparison between vortex or silicone and between surgical and non-surgical. And check mo din, syempre sa social media naman, makikita mo din mga gawa. There are many sites now you can check for your doctor's background. Sa akin lang, I have good mentors that I'm proud of. They're from the big institution. So, yun pa lang, I have good credentials na for your doctor. So, syempre, you have to see the work. Baka naman maganda yung credentials, pero hindi maganda yung gawa. So, you have to check.
Guys, kung naghahanap pa kayo ng doktor, andyan na yung sagot. Ito, Doc, sa mga wala namang budget, meron ba yung mga nag-offer ng free, yung undergo ng training ng physicians? Meron ba mga ganun na nag-free?
Actually, for us ENTs, part ng requirement namin before we graduate is rhinoplasty. So, I think yung mga nag-offer ng ganyan, meron namang consultant or more experienced doctor na mag-help sa kanila during the procedure. So, walang kaso doon. You can still trust those doctors, especially the ENTs.
Alam niyo na, guys. Pero syempre, very important, mag-background check tayo sa mga doctors natin. Kasi permanent yan eh.
Yes.
Face mo yan eh. Yan yung iharap mo sa tao. So, kung palpak, paano na lang? Okay. Ito, Doc, final question natin. Pwede ka ba magbigay ng mga 3 advice lang sa magpapagawa? Kung may gusto ka pang i-add up dun sa mga sinabi mo kanina.
Okay. So usually, part of my pre-op is preparing the patient. No? Sabi ko nga, madaling gawin yung procedure, like on my part. Pero, for example, if you're not emotionally prepared, may magtanong sa'yo na high school classmate mo, tapos tinanong kung nagpagawa ka, alam mo ba yung sasagot mo? Some patients kasi, natatrauma sila pag may nagtatanong. So, kumbaga hindi sila open na matanong or hindi nila tanggap. No? You have to prepare then, aside emotionally, financially. Siyempre, it will take you leave from work, diba? Some patients, pinag-ipunan talaga nila yung mga OFWs. And you have to prepare physically, no? So, kailangan, part of it, healthy ka or iwasan mo yung mga inom, alak, yan. So, emotionally, financially, and physically, kailangan mo mag-prepare.
Handa ka dapat. So, ito yung final message ko, guys. Kung ano man yung makakapagpasaya sa inyo, gawin nyo. Huwag yung pansinin yung sasabihin ng ibang tao. Pero, syempre, dapat handa ka pa din sa magiging result and expect pa din naman ng criticisms if ever. Thank you so much, Doc Ruth, for guesting on my YouTube channel. See you again next time here on Med Talk!